Exercise is important to good health, but people often get hurt when participating in sports or other physical activities. Our next guest says a sports injury can happen suddenly or develop over time. This segment is sponsored by TPMG Foot and Ankle, Virginia Beach. Zachary Rasor is a foot and ankle surgeon. He joins us now. Welcome to the Hampton Road Show.
Thank you. Thanks for having me.
Let's talk about some of the more common things that people are experiencing. Maybe they don't even know that this is what it is. They just know they're hurting. Plantar fasciitis, tendinitis, commonly seen in athletes, military members, beach walkers, and those who work all day on their feet. Tell us more about those conditions.
Yeah, I'm glad you bring that one up. So that's a condition, it's an overuse syndrome, something in the groups that you mentioned. And I know there's a big military presence here and, people with jobs on their feet. So as the bottom of your foot becomes sore, a lot of times it's just related to overuse. So several different treatment regimens for that, and that's one of the things in the office I kind of like about my job is we can discuss goals and figure out which treatment plan works best for the patient to try to get them to meet their goal and get better at the same time.
And when it comes to those overuse injuries, are there signs to look out for early on to prevent it from getting so bad?
There are some of the more common initial findings would be just sore feet when you get up from bed in the morning. You set your feet on the ground and it takes a minute to get going. A lot of times it's at the bottom of the feet and it can radiate up or out towards your toes. And things usually just progress and get worse from there. But generally, yeah, just sore on the bottom of the heels.
Yeah, so pay attention to your body so you can nip it in the bud before it gets too bad. Leveling up from that, let's talk about fractures. What do people need to know?
Well, two categories of that. So, of course, we usually associate fractures with traumatic events. But also people can develop stress fractures. And again, if you're walking on the beach a lot or something like that, you can get tendinitis and soreness, and you can get little stress fractures, which can develop into a full-fledged fracture. And a lot of times with that, then it gets a little complicated with care, but it's not too hard to get things healed up and get you back to being active again.
What about another common issue, ankle sprains? How bad can those actually be?
Well, they can get pretty sore, pretty bad. Most of them can be treated non-surgically. Usually we utilize MRIs, advanced imaging, to figure out the correct pathway. But when they get more severe, that's usually when they need a little help surgically. They all feel the same, though. It's usually a pop, a snap, and a twisting that's followed by bruising and a lot of swelling.
So at what point do you need to make a decision? This is more than just elevating my ankle and throwing some ice on there. I need to go in and be seen. Where is that line?
Well, generally, if you have trouble taking steps and things aren't getting better in a day or so, usually people come on in. And from there, like I said, that's, you usually rule out fractures with x-rays, but a lot of times an MRI can be helpful to, get a little closer look at the soft tissue. But generally, yeah, if you twist it pretty good, you hurt something pretty good, not a bad idea to come in and get seen.
All right, thank you so much for joining us, Dr. Rasor, on the Hampton Road Show.
Thank you for having me.
This segment of the Hampton Road Show is sponsored by TPMG Foot and Ankle, Virginia Beach. They're located at 4421 Virginia Beach Boulevard, Suite 114. You can give them a call for more information at 757-963-7676, or you can also visit mytpg.com and connect on Facebook, Tidewater Physicians.